name is Elle from the Mage System, and I have a video for you here today. We were watching a video by Mia Mulder. I think it was called, What If Psychiatry Isn't Real? And a very thought-provoking video. And as somebody with a hyperfixation on psychology myself, I had some thoughts to add. Now, given that this is a channel about DID, you can probably guess I've had some struggles with mental health before. And oh boy, I certainly have. In fact, I've been diagnosed with several things over the years, like way too many things. Do I have all of them? I don't know. But at a certain point, you kind of realize, after meeting enough mentally ill people and being mentally ill yourself, that they all kind of blend together, the mental illnesses. They all kind of just start looking like the same thing. And so, a loose hypothesis here, what if they all are kind of the same thing? Let me give you an example. OCD. So OCD is an anxiety disorder where you spend a long time performing compulsions and or just obsessing about things. You perform compulsions to stop the obsessions maybe, like washing your hands way too much, or maybe you turn the light switch on and off and on and off because you are convinced that if you do that, then a family member won't die, or something like that. Or they could just be obsessions. And I've been diagnosed with OCD, and this is kind of my experience with it, is you obsess about something for way too long, like at least an hour every day. And then you think to yourself, that sounds a lot like just anxiety. So when does it stop becoming anxiety and start becoming OCD? Well, I'd have to say, once the obsessions become pretty specific, like about the world around you not being real. That's what mine was. Or maybe it's about you being a terrible person. I've seen that in a lot of people. But what if your obsession is about whether people think you look stupid or not? What if you're laying in bed obsessing about that? Is it OCD or is it anxiety? Who knows? Let me pose you another example. Schizophrenia oftentimes can look a lot like anxiety, of course, before it blows out of control. It can often just look like being paranoid, that people around you want to hurt you, or that people around you are looking at you funny. And then the lines start to blur. Maybe you start hearing your name called out. Maybe you start actually being literally convinced people are trying to poison you. But the thing going here is that these all start to look very similar. Of course, there are defining lines. When you start entering full psychosis, you're obviously in full psychosis. But it's just to highlight that a lot of these are very related. A lot of these are very similar. A lot of these are spectrums. Your brain is just a kaleidoscope of different symptomology. And, maybe they don't have to be so boxable. But instead, as a society, we like clear categories. We try to say, well, you have enough of this symptom on this scale and enough of this symptom on this scale that you should fit into this box. But in reality, yeah, you'd fit into that box, but you certainly don't have to. And that's not actually how your brain presents. Your brain isn't just like, here, OCD. It's, here's this symptom and this symptom and this symptom. And we determine what diagnosis looks most similar to your cluster of symptoms. So it's just to highlight that your brain doesn't work in boxes. Let's talk a little more about OCD. So, a lot of people think OCD is just a purely neurological thing, that, bad genetics, you got OCD. When I'd say a good majority of the time, it is kind of a neurotype in a way that is activated by trauma. Let me give you an example, and I'll ask the person if I can tell this story. A person I am close to was hurt by somebody who was a bad person, and after they were hurt, it activated some OCD tendency within them, and they began to be convinced that they were going to hurt somebody else, even though intrusive thoughts are just ideas of what you want to do the least thrown at you, trying to make you scared. to the point where they even locked their own cats out of their room because they were scared that they would hurt them. That is activated by trauma. I know my OCD was activated by trauma. Essentially, I isolated myself when I was about 13 from the rest of the world, and once I did, it was such a traumatic experience being cut off from everybody and being left alone with this dark abyss in the back of my head that I kind of started becoming convinced that nothing around me was real. Or maybe I wasn't real. Either one. But I would sit in bed and think about it. In fact, I became obsessed with nihilism and philosophy and just trying to figure out where my childhood self ended and I began. And that was 1000% just trauma talking out of my mouth, making me obsess over and over and over again. I would write and try to figure out what was happening. And I guess writing could be a sort of compulsion in a way. But that OCD was essentially OCD about a different disorder, depersonalization, derealization disorder, which is a dissociative disorder where you feel like either you, your thoughts, your feelings, your body or whatever isn't real, or everything else isn't real, which does not have to be obsessive, but I became obsessive about it. But you see the symptomology start to bleed together because depersonalization, derealization disorder is caused by trauma, which I have another dissociative disorder, dissociative identity disorder, which is essentially a severe form of complex PTSD. And all of these are just bleeding together and interlacing, and it's a bit of a clusterfuck after you get past CPTSD. Essentially, you don't know what symptomology is what or anything like that. I'm pretty symptomatic of bipolar too, but because I have so many diagnoses, I'm reluctant to say that I have it. What if it's just this disorder presenting as this, or a severe formation of this, or what if it's just an amalgamation of shit? What if every option I just stated there, including actually having bipolar 2, was just the same thing? In reality, there's no just, you have this definitively. All you are is a set of symptoms. If you fit the criteria, you should have it, right? Because you have all of the symptoms by definition. So, my proposition is, these are all kind of the same thing. Obviously, they're not the same thing, but they're all spectrums of each other. You know what I mean? I made a video, my last video, of how CPTSD is almost DID, because in CPTSD, you do see slight fragmentation of the mind. You have parts of your mind that perceive the world in an entirely different way than you do. The only reason it's not multiple personalities is because that different perception state still identifies as you. But it is on the road to becoming multiple personalities, because every goddamn disorder in the DSM is a spectrum, but not even just a linear spectrum, a circular spectrum. Take autism, for example. A lot of people say high-functioning autism, low-functioning autism. We use terms like on the spectrum, but in reality, autism isn't a linear spectrum. You have one little tank for eye contact, one little tank for social awkwardness, one little tank for stimming, one tank for rigid routine. You just kind of look at the ratios of everything and you're like, looks similar enough to autism for me to diagnose you with it. It's not a fluid spectrum, because you may have somebody who is really high on the social awkwardness spectrum but really low on the stimming spectrum, and they have just as much autism as somebody who's pretty low on the social awkwardness spectrum, pretty extroverted, but who stims a lot. That person might look a whole lot more autistic than the other person, but they average out to having the same amount of autism. But I think the problem here is that we're interpreting your amount of autism based on what we as a society consider normal. I used to think that gender dysphoria was a mental illness back in the Calvin Garrett days. My argument then was that being gay obviously isn't a disorder, because if you take away the societal stigma, you're not in pain. But being trans, if you take away the societal stigma, you're still usually in pain with your own social presentation or your own body. But, see, that's not really true, because gender is a social construct. So if we take away all societal components, then gender isn't even real. So what the hell is being transgender? Well, but then maybe you still have the parts. Maybe you have genitalia you're not comfortable with. But it's still not a disorder, and here's why. Once upon a time in the DSM, there was a disorder for bereavement. Basically, when a family member dies and you feel like shit for an abnormally long time given. But part of the criteria for depression was that you could not be depressed because a family member died. That is not an okay reason to be depressed for. You would either just be normal or you would have bereavement disorder. But then, at some point, people realized, what if you're just depressed because a family member died? What if that doesn't have to be a separate thing? What if you're just depressed because you don't have the genitalia you would like? Then, you just have depression because of another cause. Why does it have to be a new separate diagnosis? It just really takes me back to just the underdeveloped days of psychology when we considered so many different just styles of existence a mental disorder, when really they're just ways of existing that some people have. Some people uncontrollably have. Then, I started to realize the same thing about autism. I have done a lot of research on autism, and one thing I hear a lot is it is not autistic people who are impaired, but it is the fact that in the external world, there are not enough accommodations. This world is go, 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 go. That is a society we've created for ourselves. And some people, their neurology isn't cut out for that society. That's not their fault. Mother Nature did not craft them to be in this situation. It is the fault of the society that was built around them. Is autism a disorder, or is it just a different neurotype? Just a different type of brain? Same thing with ADHD. The only reason these disorders might be impairing for you is because the world around you doesn't have enough accommodations for you. Basically, what a mental disorder is if you're not having enough productivity in this society and you're not looking like everybody else in this very specific society we've built, then you are not suitable. You need a diagnosis. You need to be declared unstable or different. Let me go back to talking about OCD being a neurotype for a second. OCD is typically a neurotype, meaning it is usually a way that your brain is naturally predisposed to acting, except most of the time it's activated by trauma. However, sometimes the neurotype is just such a strong predisposition that it presents alone without trauma, or maybe just a tiny bit of trauma, like your parent getting in a car accident but they're completely okay and everything's fine, but after that you spiral out of control. There's different strengths to what the neurotype can be. And then there's some disorders that aren't caused by a neurotype. They're purely caused by trauma, like PTSD. But who's to say that some people aren't more naturally predisposed to developing PTSD? I mean, there's a whole thing called the window of tolerance of how much trauma you can take before, you end up getting hyper or hypo-aroused. If you get hyper or hypo-aroused enough, you might develop PTSD. So there's kind of a natural predisposition to everything. Sometimes you have neurotypes that don't need to be activated by anything, like autism. You're just autistic. And then you have the neurotypes that are usually activated by trauma, like OCD, borderline personality disorder, usually like 99% of the time activated by trauma, but sometimes the neurotype is so strong that it presents alone. And even a lot of times bipolar is activated by trauma. And then you have the purely traumagenic disorders like PTSD, DID, but even then you could argue there's sort of a predisposition there. you see it's kind of a flowing spectrum of what you're born with and the way your brain tolerates existence and what happens to you. But I'd say the vast majority of the time, the things that happen to you are exacerbated by trauma. For example, maybe you're born with a sort of predisposition with autistic traits, but you don't have enough to be diagnosed as autistic. Your brain, if you put it on the brain scan, it might look borderline autistic, but you just don't have enough symptoms to get diagnosed. What if a trauma happens to you, and then, suddenly, your autism symptoms start to exacerbate a little bit? It brings them out, and then you're kind of diagnosable as autistic. Well, you've exhibited enough symptomology to argue that what if trauma exacerbates just about any mental disorder? If you have a stuttering disorder, what if it gets worse after you experience a trauma? If you have ADHD, what if it gets worse after you experience trauma? We like to treat lots of disorders with medicine, and it makes complete sense if you're just like, ADHD from birth, nothing happened, that's just how your brain works and you need to get shit done, so you take a medicine. If you're bipolar, just because you're bipolar, taking mood stabilizers probably going to help your bipolar. But it's kind of tricky there, because what if you have a strong natural predisposition towards bipolar, but it's really been exacerbated by trauma? If you just go take medicine, it might not get rid of it all the way, because there's still some sort of a psychological element there to what you're experiencing, still kind of a misbalance in your existence that would probably help a lot if you went to therapy. Let me give you another example. I take Vyvanse because I'm diagnosed with ADHD. Do I have it? I don't know. The Vyvanse helps me focus though, so I take it. It also helps with depressive symptoms, but one thing I know about Vyvanse is it is fucking expensive. It is very expensive. Without insurance covering any of it, it's like about $10 a pill, and with insurance it's about $2 a pill. You know what other disorder is also treated besides ADHD with Vyvanse? Binge eating disorder. Vyvanse is a stimulant. It increases metabolism, it suppresses appetite, and sometimes if you're a person with binge eating disorder and you take Vyvanse, it will reduce binge episodes. But when I heard that, I was like, that's insane. Why don't we start giving the medicine to people with bulimia too? It's the same problem, they just throw up afterwards. But you wouldn't, because that feels icky. Because bulimia is such a psychological problem, not a chemical one. But binge eating disorder is literally the exact fucking same. The problem is not, you're just too hungry, we need to make you less hungry. The problem is that you're probably not happy, That's really not how it works. And maybe it does lead to, less binge eating episodes, and if you take it and it's helping you, by all means keep going. But what if you just replace it with a different unhealthy coping mechanism because you're not actually healing? Maybe it would be good just as a temporary additive in therapy, only if it was really necessary, but to put that as just a really just solid, just take some Vyvanse and you'll get better treatment is a little weird. But I think what really caps it off for me of that this is just a whole drug company trying to make more money is that binge eating disorder is the most common eating disorder, and Vyvanse is really fucking expensive. You're not prescribing these people Adderall because Vyvanse costs more. It's more expensive, and binge eating disorder is really common. So we're really over medicalizing it and acting like some people are just fucked, instead of being maybe this whole ecosystem is a little bit fucked. So if the question is psychology even real, or are we just all a different bunch of neurotypes and experiences? That's not all psychology is, and I know that. I think a large portion of it is just philosophy, and then I think another portion of it is just we're all different people with different neurotypes, and we all don't have to be a different disorder just because we're different. But there are genuine things like developmental models and theories of how the brain works, and structuralism and functionalism that don't have to do with disorders, that are really legit. And I think that is what psychology could be. I hope this offered more perspective to you. I hope it helped you in some way. I hope you found it interesting. Just wanted to offer some of my observations, if you will. Let me know if you have any thoughts. Let me know if I said anything that wasn't correct about your disorder. I try my best. This was L from the Mage System. I don't know if I said that at the beginning. This is L. Anyways, I'll see you later.